Hey, everybody. This week, we are very lucky to be joined by Ross O'Brien, who is basically, I think of you, Ross, as like the VR guy, the XR guy. And we're going to link in some gaming stuff as well into this one because gaming and health tech is becoming a thing. So I'm super excited for this. But Ross, welcome to Healthtech Pigeon Podcast. How are you, sir?
Yeah, good. Thanks. Lovely to join. Lovely to be part of the pigeon flock.
Absolutely, mate. Absolutely. And we also have Harry here from SomX. So hello, Harry.
Hello, I'm very excited to chat to Ross and hear what he's got to say.
Well, I thought it was gaming, Harry. So I just thought, you know what, XR gaming, surely bring Harry into this one, right?
It's quite ironic as well that I'm wearing I don't know if you know Razer.
Oh, could just about see, yeah.
Yeah, quite ironic that I'm actually just wearing a Razer sweatshirt today. So yeah, I guess that says quite a lot, doesn't it?
Oh, probably lost on many of the people listening.
Yeah, no, exactly.
Very much appreciated in this room. So
yeah,
for anyone listening that does get that, feel free to write us in and you can come on the next one of these. Delighted to have you on, man, and great timing to have you on. You were just saying you actually drove up to Liverpool from Brighton to do an exciting launch, didn't you? So do you want to tell us, first of all, why on earth would you decide to drive? And secondly, what was the launch? What were you launching? And what's exciting for Healthtech and XR currently?
I've got ADHD, so lots of the decisions I make, James, are on impulse. I'm not really. I ask myself the same question a lot of the time. We had the privilege of going to University of Liverpool. I'm from an organisation called the XR Health Alliance, and we've been working for many years now to scale the use and application of XR health tools. We were really excited to be commissioned by the University of Liverpool for one of our recommendations for our 2020 XR Health report. And the commission was to landscape map the UK in terms of where XR health applications are happening. And so we did a huge bit of work to create an interactive report. And it's got an interactive map, it's got an AI chatbot that kind of takes you around the report, but ultimately so that solution providers in the space, so that academics, so that the NHS could understand what's going on in the UK across all XR health verticals, where there are pockets of work going on, and who's doing what in what space. So it was great. We went up all the way to Liverpool and back in one day, rather foolish. I live down in Brighton, by the way, so that's why it's that foolish. Launched our report there, which gave us great joy.
Awesome. The interactive map, which is available online, I'm not going to read out the website, although landscape-mapping.xrhealthuk.org/map. There you go. I'll stick it in the show notes. It's not that catchy, is it? So I will stick it in the show notes. But it's very cool, and there are lots of things going on. And I think the thing that got me with this was I can remember when I was doing accelerators, which was a fair amount of time ago now. Talking, what was it, 5, 6, 7, 8, maybe even 10, I don't know, a long time ago, between 5 and 10 years ago. And I can remember XR coming onto the scene then. So VR and AR, virtual reality, augmented reality. And I can imagine, I can remember those early conversations about how it could be used. And I notice whenever there's a new technology that comes out, often the first uses of it in any industry really are play and potentially some gimmicky stuff, and like people trying to artistically, I guess, experiment technology first rather than problem first a lot of the time, just to see where it can be used and to see how it could be used. And I think a lot of that kind of artistic exploration is actually quite important as well. It's very different to the, I guess, more startup-y entrepreneurial hypothesis generation, start with a problem, figure out, fall in love with the problem, technology agnostic. It's different to that, I think, when we're learning a new technology and we're seeing this play out now, I guess, with AI and, video generation by AI. What use is that? Like, we can't really figure that out yet, but it probably will show itself down the line. But it was really interesting back then because a couple of different use cases stuck. It seemed to be like pain management, particularly in pediatrics, or distraction therapy. That kind of thing seemed to stick, but definitely education and training seemed to stick as well. I can remember back then, and people creating genuine business models around that. And I'm sure there were other things. But what I thought was really interesting looking at the interactive map was that all the different categories that clearly other things did stick that either I wasn't quite aware of, or at least, didn't have the focus on it. So even the top level categories here, clinical and surgical, 37 things going on there, health, lifestyle, and fitness, 12 things, mental well-being and therapy, 130 things there, pain management, 20 things going on, patient education and training, 29, physiotherapy and rehab, 33, education and training, 9, workforce education and training, 89, and other, 20. And that's an interesting category that I'd like to get into, but super interesting that actually the uses are all around the country. There are dots all the way up. My Scottish geography is not good, but very near the top of Scotland and very near the bottom of Cornwall as well. So literally AR and XR, VR, all these terms, it's all being used right across the country. So I'm really interested to get into this with you because you've had the view of this sector that entire time. And so I'm interested in what your take is on where we were then versus where we are now. And can you just sort of explain that journey for me?
I think the best vehicle to explain that is actually my journey into the world of XR myself. So
Nice.
um, I used to run and manage mental health services in the NHS. Worked across London for a long period of time. Always interested in digital and making sure that people had the same experience digitally as they had in the clinic. Um, and Back about 8 years ago, I was managing the West London mental health services when the Grenfell Tower fire happened. And it happened next door to my hospital. And so the morning of the fire, I found myself at the bottom of the tower, helping with the trauma response, so helping the community,
Whoa.
survivors, bereaved, everyone affected. We went on to stand up the Grenfell Health and Wellbeing Service, and part of standing up that service was kind of an offer from the government around, doing the right thing by the community. And at the time, we saw an opportunity to actually have some investment in digital and to think about what we could do to offer the best kind of wraparound service that wasn't only about the physical and direct health provision for trauma, but also what we could do online. And I'd started to become interested in the world of XR, and I knew one of the applications that was quite strong and quite well researched was around trauma. And being able to do reliving and graded exposure through the medium of VR in quite a controlled way. And what was interesting was, even though we had some funding to do it, when we looked into actually using VR as a medium for treatment, there was no guidance. There was a limited evidence base, mostly in the States by some amazing leaders. This guy called Skip Rizzo done a ton of work in the space, and a few other kind of leading clinicians. But it felt like a kind of a missed opportunity because we weren't dead sure, especially with something like Grenfell. It's obviously so important in the national eye. There wasn't space to kind of mess it up. We had to get it right. So we kind of put that application on the shelf, but we still thought, what can we do in XR as a medium to engage the community and to benefit the community? And so we started to go out with, those pull-up banners that just say NHS, and we go to Portobello Road Market or the Westway, where some of the original support had happened for Grenfell. Pull up a banner and hang around with a bunch of VR headsets. The first question people would ask us was, "Can I have a go? That looks quite cool." And the second question after somebody had had a go would be like, "Why are you here as the NHS with the headsets?" And we simply said, "We want to kind of reach out to the community and show them we are here." What we didn't expect was the people that we talked to completely and utterly opened up about what was going on for them in terms of their mental health and their well-being, or their family or their friends, in a way that we'd never seen before. Like, mental health community outreach is really important. Decreasing stigma, building bridges to communities. It was by far and away the most powerful tool we've ever seen, and I think it was just the opportunity to connect with somebody, give them a new experience, and the barrier of kind of scary clinician or scary NHS person that's going to talk about mental health completely disappeared. Um, and so at that point, we learned that it was a very powerful machine and had tons and tons of applications. But for things like pain management, physical rehabilitation, clinical skills training, patient education, or various applications of mental health, there wasn't guidance, there wasn't funding. And we used to kind of see maybe in a conference, somebody would get wheeled out and put on stage, and they would talk about the fantastic work that they did, and maybe it would have an impact for tens, if lucky, hundreds of patients, but normally tens. And then they would kind of go back off stage, and we would go and talk to them afterwards and be like, "That's amazing. This needs to scale nationally." Most people would kind of look quite deflated because there wasn't at the time anything to help scale XR technology. And so our first report was very much around what's out there, and there are a couple of case studies in each kind of health vertical, but also what was necessary in order to help scale all of XR. And so we put that out as a series of recommendations, our thoughts on creating essentially a pipeline so that XR could be systematically grown, and thinking about compliance and regulation, thinking about sharing good practice, thinking about investment, thinking about development directly with patients in a safe kind of sandboxed environment, and then thinking about how it could be scaled on a national platform. And we were lucky enough that UKRI listened to us, and they invested £20 million in a program called Mindset XR. And so now, kind of wheel forward to present day, we've got a program which has taken, I think there's about 74 companies that have gone through the program. It's specifically around mental health, so it doesn't support pain and rehab and all of those other health verticals. It's just about XR health and XR and mental health. But what we've seen, and has been amazing through that, is we've seen companies go from kind of nascent idea all the way through to companies that are now selling into the NHS, direct to service, or actually at the scale of ICB level as well. And it kind of proves out that if you concentrate efforts and finance and resource at one particular issue and think about it in a systematic way, you can bring together the investors, you can bring together the regulators and the governing bodies to kind of think about new solutions and help them scale. So the good news is we've gone from a position where me back in kind of early days of Grenfell, not being able to use those technologies with an NHS cohort of patients, to now not just kind of well-being stuff, actually looking at triaging patients, helping clinicians understand patients better, technology where clinicians are able to practice difficult conversations that they might have with patients
Yeah.
or having them. And yeah, absolutely tons in mental health. And I think that's the great gain that we've made, is that now the NHS is starting to realise, okay, there are technologies there now that can develop a good evidence base. They can show return on investment, and when deployed with that kind of like lead-in support,
Mm.
they're massively effective. So yeah, it's a positive news story.
That's great. That's great. I'm intrigued then. When you did this mapping of everything going on, as someone who believes in this technology and has seen it like firsthand as to how this can be helpful for people, particularly in mental health, were you glad to see the level that we're at in terms of deployment around the country, or were you sad to see the level that we were at of deployment around the country? Where, I mean, how many people is this helping? Is it anywhere near enough? And if it isn't enough, what are the barriers to scale? What is going to move the needle here?
In answer to the first question, yes and no. We've come a long way, and it's fantastic that there are, so many companies working in the NHS. But what we hear day in day out from supporting them directly is, we're in one, two, three kind of hospital facilities, but there's nothing helping us to kind of have ubiquitous coverage. There's still a hell of a lot that needs to be done around regulation and compliance. It's very woolly in that area, and I think there are, for specific use cases, there's the first nice early value assessment
Yeah.
for XR, but it's in a very specific kind of health vertical within mental health. Um, what we need is more help and support in that area to create frameworks for the safe deployment of XR, guidance around it, to essentially breathe confidence into purchasers, compliance and regulation leads for trusts, CCIOs, so that they're able to look at it and actually go, yeah, okay, this is safe, we're going to do it, rather than at the moment, it's still, after a very long time, an emerging technology.
Yeah.
Mm,
That's a really interesting phrase because that is how it feels. It feels to me like it's never really had the breakthrough of, oh, okay, this is now a staple delivery mechanism of an alternate reality that can therefore do X, Y, Z, A, B, C, one, two, three. That unlock doesn't feel like it's ever happened, despite, by the way, on a very anecdotal level, having used it and tried it myself, the sort of perception shift that I've been through in an absolute microsecond of not being in a VR environment to then being in a VR environment. Harry, you're nodding. Like that. That is a crazy. It's a crazy shift to have experienced. And by the way, for anyone listening that hasn't ever stuck a VR headset on and has or doesn't have any impression of VR, my goodness, please put a high fidelity decent headset on and have that experience, because it is it is genuinely perception shifting of as oh, okay, there's a lot that we can achieve now because we have a fully controllable environment. And whether it is immersion therapy to get over phobias, whether it is creating family members and having an experience where you can get over trauma, perhaps it is distraction for pediatric pain and allows a child to have a cannula put in because a little baby fox goes and nips them on the hand and that's what they end up feeling. All of this stuff, just the ideas for anyone entrepreneurial, just I mean, for me, it just exploded as soon as I put a VR headset on, to be perfectly honest. It just gave me such a deep respect for this as a sector and as a technology, that it leads to this kind of, what you can probably hear in my voice, of this like surprise that we haven't actually broken through with it. Um, but yeah, and also, I mean, I'm a gamer at heart and very much in practice, and so I can understand it from that perspective as well. And it's funny, like the element of play that we were talking about before, we started recording. I wish we were recording, but we were talking about, when kids get together and play and they feel like they can explain things, when they can imagine things in the actual world and reality. I mean, this is how I connect with my friends and end up. I even say to Jess, this is my mental health hour, when I literally go and play on my PlayStation online with my friends, and we have a distraction or a shared goal or whatever it is in like the game that we're playing, and actually we can get a lot done and talked about in there that I couldn't really just ring it up and say down the phone, because that would be weird. So there's so much baked into this for me, and there's so much sort of that I can see this can do, both now and in the future. And you actually wrote 6 really actionable steps into this report, right? And you've been through a lot of them there. Developing the national XR strategy for healthcare, deploying it to advance the NHS strategic priorities. And I think that's a really nice one, because that alignment between what the NHS needs to do and showing that this is a technology that can do it, that alignment's important to enter a lot of those conversations, I think, which is great. Obviously, strengthening the evidence, expanding the infrastructure and ecosystems, improving the funding and policy regulation and scaling as well. So a lot to be done. Um, and my question at this point is, you've heard there, I'm obviously someone that likes this and is passionate about it, can see the change. Do you find a job still is to be done around convincing people rather than, and you probably have champions, right? You probably have people that do just genuinely innately believe in it, but probably a lot of cynicism to deal with as well. Are you still battling against that, or do you feel like this is on a level playing field of other technologies?
You know what's fun about it? I think irrespective of if it's XR or AI or whatever new tech, there's always pushback when you put it in the hands of clinicians or patients for the first time. There's always kind of naysayers. What we find time and time again with XR, and like you said, um, is put a headset on and just have that experience. And all of a sudden, all of it kind of floats away. I'll never forget. There was, and it's not breaking confidentiality. There was a particular person that lived in the local neighbourhood around Grenfell, that had really struggled with the event, and it had really triggered a lot of previous trauma for them. They'd kind of backed into their home and were really just kind of refusing to leave. And at the time, one of my therapists was also kind of like, we haven't got time for this technology rubbish. There's actually people that
Mm.
have been massively traumatized, and they're like, that's what we need to be concentrating on, not having team meetings about new technology where we don't know how to use it. Like, go away, Ross, not interested. Um, and we took an approach of saying, okay, there are 10 headsets in the office. Please take a headset home with you, and in the evening for yourself, use it as kind of escapism, fun. Like, you've got a really, really hard job. Just please go and just, see what you think of it. And quite quickly, by doing that, lots of the staff kind of got it conceptually, and then started coming to us and saying, well, what if we used it for this and that and the other? One of the largest naysayers in the team didn't say anything to me, but actually took the headset to the person that was at home, struggling to go out. They'd seen a psychiatrist, a psychologist, mental health nurse, social workers. They'd seen a lot of people, and they weren't moving forward. In fact, they were kind of moving back. When our psychologist went and had a conversation and just kind of left a headset with them. They took it upon themselves to go into Google Earth and have a look at the local area on their own, and effectively did what's called graded exposure therapy for themselves with the headset. And a few weeks later in the office, the therapist came up looking a little bit sheepish, but also really excited.
No.
She said to me, I was in the Londis in Ladbroke Grove, and the lady we've been trying to work with was standing next to me, smiling.
Whoa.
She was like, "We didn't do any of it. She completely did that herself," and we were like, "That is amazing." And I think it's at that point when you give the tech out to the healthcare workers, you let them understand and explore it. All of those boundaries dissolve. And whenever we do events, we always try to do it in a different way to how you traditionally do kind of like a healthcare conference. We try and lead with the XR tech itself. So don't say to people, go and do some networking. We say to people, go and actually talk to those guys. Go and talk to Tend. Go and talk to Stroll. Go and talk to whomever's there on the day, and actually put their headset on and see what they've got. And at that point, people totally get it, and all of those boundaries come down.
It's so important, isn't it? Open-mindedness. I've actually had a few conversations on this and the other podcast recently that I I've I spoke to Flow Neuroscience the other day,
Mm,
um, and their TDCS technology, the transcranial direct stimulation, applying a little bit of current to, of course, yeah, mental health, you would know this, yeah, you apply a little bit of current to the brain, and there's a few theories of how it might work and stimulate a part of the brain that can be, underperfused or underdeveloped in those that are at risk or suffer from depressive symptoms, and that helping. And it's funny because I had a chat to Daniel, the founder of Flow, about this, about how as clinicians we're trained to be cynical because that's actually what is largely keeping the entire system safe. Because if we didn't have that level of cynicism and we were able to be sold snake oil all the time, then a lot of healthcare would be at risk because we'd be trying things without true scientific rigor, and it would be a waste of our time. Of course, there always has to be an experimental sort of R&D layer to what we do as a system and what we do individually. I think that is incredibly important, but we're also trained to find problems in things in the healthcare industry. You'll know this as well, Ross. Like that's it. We're literally trained to find problems, so it's very easy for us to find problems in things. And so I have a lot of sympathy for the person who doesn't want us to waste our time, because there's people in need, and we have all these things that are evidence based and they are resource intensive, but we know they're evidence based. And so can we please focus on that rather than experimenting with this new thing that's going to turn out to be a waste of time, and we could have helped all these people if we hadn't have just experimented and wasted our time. So there's a lot of sympathy that you expressed, with them, and handling it with tact and with care, leaving the headset with them and allowing them to do it, to explore it. And especially for almost like that treatment resistant cohort where there's nothing else left, it's like, oh, okay, cool, yeah, let's leave them with that. But I think the general principle, I think, as clinicians and people that work in healthcare, is that with this, and even with chatting to Flo as well, same thing, that healthcare isn't going to look the same as it is today in 100 years, in 1,000 years. It isn't, and so it's going to be the open-minded people that don't mind saying, well, I don't know how this works, or I don't know how this might work, but I'm going to try it, or it did work and I don't know why, but we can sort of retrofit that later. We can do that scientific exploration and rigor. But it's like I said at the start about, when we have a new technology and the more artistic version of innovation, which is to play and explore rather than start with a problem, being somewhat important, I think, in our own practice sometimes. And of course, you've got to balance that. You can't do that with absolutely everything. But where you do have a technology like XR that you might just not be au fait with, but I think what you've done a great job of here is showing, well, here's a map of the UK, and by the way, here's all the places where it is working. So perhaps be open-minded, perhaps start that exploration journey, perhaps have a look at all the use cases where this has worked, and maybe think about one for yourselves in your own system, in your own practice, in your own department, or whatever it is. And if it is something that you're interested in, here's some stuff. So I think that, helping get over the inertia of people that haven't used it before. I think everything that you've done here is just so important. And the other thing that I just want to raise, actually, Ross, is you've told a couple of stories there, and I think that anecdote is incredibly important as well. As a scientist, we're told often to ignore the anecdote, n equals one being a pejorative phrase. But I was at an event last night about it was at TikTok, actually, but I've been to similar at Google with YouTube and all the rest of it, where they actually talk about the fact that when you're trying to enact change in healthcare, the numbers and the statistics and the evidence is one thing, but anecdote and story is another. And it does have value because we as human beings identify with story, and we enjoy listening to anecdote, and we listen and we actually take heed of that stuff. And so, whilst it might not have the scientific rigor, you are allowed to explain, in this circumstance and at this time, this is what happened, and allow yourself to be taken with that, and see yourself in that journey, or see your patients in that journey, and actually let that inspire you to try something and make a change. And I think that is important as well. And so, thanks for explaining all that. Is the first thing that I want to say.
There's a few things that I'm intrigued to talk about, from the fact that you were talking about the sort of initial barriers to AR adoption in the UK and the NHS, and I was thinking how that's not, from my understanding, a UK specific challenge. It's that AR, XR, VR is stuck in this emerging technology bubble. It's a global thing, and it's um, an interesting challenge. So I was then thinking about, is it a cost benefit analysis? Is it that it's not driving enough value for patients, for like hospitals or healthcare providers to be using? Is it that it's more of a psychological thing, that people aren't have some sort of stigma, or that AR is a gimmick, or that it's something that's or something along those lines. I'm just intrigued because I agree with James. It's a really powerful tool, and I've spoken to other people who are doing AR things or using them in practice, and I'm just really intrigued, like what your perspective is on the particular barriers to really elevating this tool to the kind of, not the level of something like AI, which has become massively abundant, but you know, raising the level of access to these kind of technologies in healthcare.
So it's interesting you say about kind of uh, 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 environments outside the UK. I remember going to Trinity College in Dublin, and it would have been about 12 years ago now. And the lead for clinical skills training saying that he'd already for a decade been using digital based simulation as the tool to train surgeons. And the stats that they had in terms of the decrease in incidents and accidents during surgery, the confidence of surgeons in going in and performing a surgery or specific types of surgery for the first time, and how much that was increased. The number of patients that they could see in a day, every kind of element had been affected so positively by the adoption of digital simulation and virtual reality. And I think that's probably the best kind of very quiet example of how an industry has flipped from cadavers,
That is
videos,
true.
and textbooks to XR first. And it's odd, really, that it's not shouted about. But if for example, when a couple of years ago, when Facebook or Meta launched their mixed reality headset, one of the adverts that they had was with a British company called Fundamental VR, talking about how clinical skills training had been transformed by the medium, and how it was not it's not ubiquitous, it's not 100%, but that's like the primary. So I think it's interesting. Things like that have shown that there is abundant potential for application. I think where we're at, like taking mental health as an example, in that 8-year kind of story that I've told, we were at a place where there was kind of nothing and it was the Wild West. We're now in a place where we're kind of halfway towards evidence generation, halfway towards enough examples of return on investment for the tech where we will see momentum and we will see growth. But I think there's also still a lot to be done in terms of exactly where does XR fit in mental health. And I think the same for the other healthcare verticals. But all we see is where there is money and resource and thought and effort put into those, pain
Mm.
rehab clinical skills, we see that evidence-based generating, we see the return on investment, we see happier patients, we see happier clinicians. So my hope is that we can keep on pushing, we can keep on galvanizing, and we can actually take this story out of the UK as well, because I think we are globally the only example of a country that's gone, right, we're going to do this at an industrial scale. And full credit to UKRI have been fantastic. The HIN in Southeast London have been fantastic in leading the Mindset XR program. There is a program that hits England, Scotland, Wales, and Northern Ireland, and it's got companies across all of the UK, and there's a systematic approach to it. I think what we're calling for is that same real approach now into the future, but for all healthcare verticals. And investors come to us quite regularly and say, I would invest in this technology, but there's no real kind of guardrails in terms of compliance and regulation. So we're going to kind of sit back and wait for that to happen. Whereas the regulators are like, well, it's not really enough companies doing this to like have a big push.
Interesting. Okay.
And so one of the challenges has been that the nub of that
Yeah.
dance between the
Yeah.
regulators, and that's what we're also kind of trying to concentrate on to speed up the adoption.
Before we move on to another topic, there was a couple of things from that I wanted to pick off as well. One is the evidence. I've seen some of the evidence for these AR, VR things, especially for training, and it is seriously impressive. And it makes so much sense from a training perspective to use these kind of technologies to teach people how to do medicine. It makes so much more sense and far less resource intensive. So I agree very much with what you were saying on the um, from a third party perspective on the evidence that I've seen there. But one aspect that you mentioned when we were prepping for this as well was talking about gaming, and something that I've read about or spoken to people about is in other countries they have built industry collaborations with the gaming industry. So the actual studios that produce, AAA games, they are working with them to create assets and tools for these AR VR experiences. And I'm wondering what kind of are there industry collaborations that are happening in the UK, and what your thoughts are on that perspective as maybe another way to bring capital or resources into the ecosystem.
Yeah, totally. I think one of the driving factors of the kind of success of XR as an intervention is the gamification, not only kind of making things interesting to follow, but the immersive gamification. So you actually play a part in the game. Um, I I also think that a lot of that has been driven from healthcare side. So clinicians that are interested in digital have kind of found companies that might be working in the space and worked with them to create gamified healthcare solutions. Absolutely brilliant. But there is also kind of over the hills and far away a land of a very, very affluent land of a gaming industry that is now starting to think about how can the gaming industry create a health industry as a within. Um, and this is the thing that we're really, really excited about for the future, where we see examples of like Sea Hero Quest, a very well-known game that's out there and has been out there for quite some time. The company that built that, Glitches, also had a kind of a healthcare interest and found out that um, the movement of individuals through the game could be an indicator of Alzheimer's. And when they kind of looked into it in detail, they found that actually it was given early signs of Alzheimer's up to 20 or 25 years earlier than other kind of tests.
This
Um,
blew my mind when I saw it, Ross. So I saw this like years ago, I remember they presented at the Royal Society of Medicine, and I was just sat in the audience, and I couldn't believe it. Like for people listening, you're in this little boat, and you sort of navigate like a maze, almost like a maze of islands, and you're just trying to find your way basically through it. And I'm going to butcher this, for apologies to the developers of this game, but basically, yeah, as you said, like the fact that it's analyzing your spatial awareness and your memory was able to pick up cognitive decline 20 years before, like before you get it, was unbelievable, and the evidence was so strong for it
Now
that
imagine the fact that so
oh,
many people are using that game, and there was like if we thought outside the box a little bit and used that because it's a platform that's already there. There's a lot more
yeah,
access than kind of like your average GP surgery or hospital or clinic facility. Like wouldn't in a world where we could go into a game and part of a game was a diagnostic tool or a rehabilitation tool or just the fact that you've got this platform where not hundreds, not thousands, not hundreds of thousands, millions of people already are, and to use that and to use all of the gaming engineering techniques to make it more interesting and to make it easier and to use all of the power of digital to be able to feed that information back directly to clinics. Like it's complicated, but we now live in a world of AI and it's less complicated than it used to be. So I think for us, that's the bit that we're really excited about. Working with gaming bodies like Yuki, they kind of
wow,
understand that vision, and
yeah.
they're really interested in creating like formal links between the gaming community and the healthcare community. So that's kind of big on our agenda next.
That's awesome. I was playing Rocket League yesterday, and I was looking at it. There's a few million people online, and I was just
Yeah,
thinking, like, yeah, my spatial awareness is really being tested in this game. Like, again, for everyone listening, I'm going to go from like any perception you had of me even being slightly cool is about to hit the like rock bottom and go through the floor, because Rocket League is basically cars playing football. In 3D space, so you can jump and boost into the air and hit the like. It's extremely fun. It's hilarious and stupid, but it's incredibly fun. But yeah, imagine if you could really boil down what Sea Hero Quest, what the diagnostic component is, what actually is it when you boil it down? What is the spatial awareness that you're testing? How does that link to memory, and and can we put that just into the fabric of, say, Rocket League, so that when there's 8 million people online playing Rocket League at any one time in real time, you can literally push a notification to people and be like, yeah, looking the way you're playing the game, like you might just want to, get a GP appointment and tell them this or something along those lines. What can that do for public health? It's unbelievable.
yeah, yeah. As that's the thing, and that that is is one small example of meeting people where they are, and
Yeah.
gaming mechanics to do something fantastic. So, yeah, I think it's going to be a very interesting project. And I think in terms of, Harry, your original question of breaking down barriers and getting more acceptance as well, I think that if you take health, which is often seen as something scary and stigmatized and difficult, and you put it into an environment where people go to escape and seek pleasure, but also have fun. Yeah, for me, it's kind of a simple way to make healthcare more effective.
Absolutely. On that note, I wrote down as one of my other questions from earlier on was the interesting aspect of how hard companies like Meta are going on AR, VR,
Mm.
and these kind of these technologies, and how they're betting so hard on that becoming a massive global consumer product in the future, and also what that means for healthcare. Whether we've seen it with AI, for example, that it's actually gone the other way around to almost everything else in existence, where it comes from like companies, sorry, from like governments or companies down to consumers, whereas something like AI starts with consumers, and it's b governments and companies are the slowest to adopt. So it's I was wondering whether it might be the same case with these kind of technologies. What if you have a huge company like Meta or other gaming companies as well, who are developing these devices, and if they become very mainstream and get into the hands of lots of people, whether it's actually turns into a bit of um a flipped paradigm. That obviously raises questions as well, but I'm intrigued to know your thoughts on that side of it.
Yeah, it's interestingly with XR, it's not happened in that way yet. Meta, ByteDance that own Pico, which are one of the big headset providers, HTC, Samsung, they've all kind of shown a bit of an interest in XR, but they haven't really pushed it. And I think that's something to do with payment. I think it's difficult to kind of monetize it from a direct to consumer approach. So they just hasn't been much of it. The things that have been monetized in the XR space are mainly around fitness and well-being, that kind of area of healthcare. But yeah, I'm not 100% sure that is going to be. Hopefully, I'm wrong, but I don't. I think again, it's going to come from kind of industry side, as in the solution providers and healthcare working together
Mm,
to push.
really intrigued as perhaps as a final question in a sense as well, like what is your vision for this technology? What's your vision for how this is gonna look in healthcare?
I think if I use the example of mental health, um, uh, I have presided over and commissioned for over a decade a fantastic mental health services in the UK, where talking therapy is free at the point of care. Um, uh, However, the reality of those services is also one whereby we can't hire therapists fast enough, and therefore wait lists exist for the more acuity, the longer the wait. And average waits can be anything from 6 to 18 or more months. Um, we're now seeing with XR technology companies, there are a few that were featured in our report as case studies, where they're doing kind of graded exposure therapy, or where they're doing mindfulness based cognitive therapy. And those approaches are seeing recovery rates which are just as good, if not better, than human led approaches. They're seeing 85% completion rates for the course of treatment, where normally it's around 50 or 60%.
Wow.
Cost of that therapy is about a quarter of the cost of a human-led approach. For me, just that one example of deploying a treatment in virtual reality into the NHS, so that people can make that choice. If people are like, no, I want
Yeah.
to, sod this, digital rubbish. I want to see a human. They will wait, but I know me personally, I would be like, well, I'll give it a go and use a digital approach. And I think that for me, having a systematic approach to those verticals where you've seen really strong use cases so far, of embedding them and putting them into care pathways and letting patients make the choice, so that we can create more evidence, so that we can show more return on investment, and see if the patients like. I very much remember in the early days of talking therapies deploying digital interventions, which were nothing more really than the workbook that you would do with your clinician online, and patients being like, they don't want that. I don't think we're in that same space nowadays. I think patients are actually, it sounds weird, but enjoying therapy, like enjoying going through that. So there's lots of examples of that, and people that are experiencing pain and don't have to use medication to get away from that pain and can use a VR headset. I haven't met one yet where they're like, "Oh no, I'd much prefer to take the meds, thanks." Like, it's just, for me, it's a no-brainer. So, yeah, our mission will be to continue to surface this technology as widely as we possibly can.
Amazing. Ross, been absolutely a pleasure having you on. The final question that I have is around like how do people get started with this? Because just having a look at your, interactive map here and to give people an idea of exactly how some places are using this. So Buckinghamshire Healthcare NHS Trust, they're using MetaQuest 3 for mixed reality, HoloLens 2 for holographic computing with cloud and AI integration. Chelsea and Westminster, medical grade VR with Smiley Scope for pediatric procedures, HoloLens for mixed reality, and MetaQuest for immersive experiences. So they bought three different types of VR headsets for three completely different things. South London and Maudsley, they're doing custom VR apps for eating disorders, relaxation, dementia care, DBT using Pico headsets and 3D cameras. Oxley's have purchased 14 MetaQuest 3 headsets for an internal project beginning in October. That sounds secretive. Princess Alexandra, HoloLens 2 for viewing Teams meetings and documents while consulting with patients. East London, North Hertfordshire implements Oxford medical simulation VR headsets for med student training education. It's being used across so many different things in so many different places. And so this isn't one type of clinician. This isn't one type of department. This is lots of different clinical areas, clinical departments, training departments using this in lots of different ways. So for people listening that are in the healthcare system in some place doing something and they have any sort of view, or even if they're just intrigued as to how VR could help them, could help their patients, could help their service, what is an appropriate first step if they currently have absolutely no idea where to even start?
I think, as I said earlier, the work that Mindset XR has done to champion the different companies working across the UK is fantastic. There's a huge resource on their website there that shows what they do. Obviously, our website, xrhealthuk.org, is a absolutely huge repository of case studies, links to grants and research, and yada
Wow.
yada yada. So please look there as well. And then there's organisations like the International VR Health Association, based in the US. Again, a huge repository, brilliant network of interested parties, and also. Just reach out. Like myself and my co-founder Sarah Tico are really passionate about the area. We spend far too much of our own personal time helping and supporting people because we believe in it. We've seen the power of it ourselves, and we care, and we want people to have good experiences. So equally, just reaching out to us.
Amazing. Thank you, Ross. Thank you, Harry. For everyone listening, if you go to healthtechpigeon.com, you can grab our newsletter. Ross's report, link to the interactive map are both going to be in that for this week. But yeah, just remains to say thank you. So thank you, Ross. Appreciate you, man.
Cheers, gents.